As the nation grapples with shifts in the public health landscape ahead of a new school year, the importance of childhood vaccinations is being questioned. A recent survey from the Harvard Opinion Research Program shows that 21% of respondents feel parents should be able to send children to school without having them vaccinated against preventable diseases. Of those respondents, 79% said they believe it should be the parents' choice to vaccinate their children. And 66% say they believe vaccine requirements are influenced too much by politics and big companies. However, health experts and pediatricians say despite those concerns from parents, recommended vaccine schedules are meant to safeguard the health of children and communities. And the folks at Carilion Clinic want to help your kids stay up to date with those vaccines before sending them back to the classroom. We are joined today by Brooks Michael and Dr. Ann Laverty today to discuss your options. Welcome, ladies. Great to have you on the show.
Thank you.
All right, Dr. Laverty, let's address that. We're seeing a lot of politics and a lot of, opinions vary with vaccines. Why is it important for our kids to get vaccinated before they go back to school?
These vaccines have been well researched, and really what we're just trying to prevent, some serious illnesses, and the vaccines that we do recommend can prevent your child from getting sick, hopefully keeping them staying in school, and if they are exposed or if they do, acquire an illness, just really minimizing the severity of symptoms as well. So
right.
We're happy to have them and get them vaccinated at one of our clinics.
Yeah, absolutely. Okay, so let's talk a little bit about this adolescent medicine. What is that and who can benefit from that?
Yes, so adolescent medicine, we are a group of providers here in the Valley just super passionate about our teenagers. So we really focus on the 10-year-old to 26-year-old population and that transition from childhood to adulthood and the unique challenges, concerns, and changes, that happen in those teenage years.
Yeah.
So we are here to serve the youth of Roanoke Valley.
Yeah, absolutely. Are you seeing a drop off and seeing some of that age group? I mean, why the focus there?
Yeah, so there's a lot of changes with puberty, mental health, just different exposures and peer pressure with the friend group. And definitely in the transition in the busy ages of being a high schooler, jobs, school, home responsibilities, we're definitely seeing some minimal times where they're not seeing the doctors as much. And so we have different offices, both at Tanglewood, the Lift Center, but really exciting also at Roanoke City, and we've been there for ages. We have in-school clinics or school-based health systems at William Fleming and Patrick Henry as well, to try and minimize those disruptions and let us care for your teen.
Yeah, absolutely, because there are a lot of pressures and we want to make sure that the school year is nice and smooth and they get the help that they need. So let's talk about these in-school clinics. We were talking before the show. I had no idea. This is very different from seeing a nurse. So tell me a little bit about these clinics and how it differs from seeing a nurse.
Sure. So a lot of people they get confused about that. We are a full primary care provider in the schools. So the school nurse is going to be very helpful with things like managing medications. They're going to be helpful with headaches, allergies, things like that. But if a student comes to see the school nurse and needs something beyond the scope of what they can handle, that's where we come in. We're right there. We're at school. If a parent is at work, they don't have to leave to take their child to the doctor. The nurse refers them to us, and we're right there and able to see them.
Wow, that really is, when you told me this, I was like, wow, are you in the county schools? You're not in the county schools yet, but you're in the city schools. And that really is important for parents to understand because that's really, you talk about disruptions, right? Parents have to then leave work, they have to go get their child, maybe take them to urgent care, and there's so much disruption where you're there right there in the school. So if I think that maybe my child with the sore throat might have strep, you can do that test right there?
We absolutely can. The whole goal of this program is to keep students healthy and in school and ready to learn. So we can do lab work, we can test for viruses, any kind of really comprehensive healthcare service. We do it right there at the schools.
Yeah, that is really incredible. But then there are the nurses there for the things like you said, maybe checking a temperature or administering and Tylenol or something like that, right?
Oh, absolutely.
Some of the basic stuff. But then you're there just to be a little bit more like the next step.
Exactly. Yep.
Yeah. And we're happy, we've called parents during appointments. If you can't make it, I'm going to update, with what your child is going through, so trying to loop in the parent and guardian as well, because I know that sometimes can be a concern, for parents when their child going to the doctor without them there.
Yeah, absolutely. What a great service, and we appreciate you doing that for sure. Us busy parents, that's the last thing we want to do is get the phone call. Your kid is sick, come pick them up, right?
Right, absolutely.
Yeah, so we can get those services. Anything else that you want to mention about these services and keeping our kids healthy during the school year?
I would just like to say that adolescence is a tricky time. It's a transitional time. And I've been with this program for many, many years, and I'm so proud of our team and what they do and how they care for our kids. And so I think we're so lucky that we have this right here in Roanoke at both the high schools, and that kids have access to whatever they need to help them as they transition through those formative years.
We are very fortunate that you're around. So thank you, ladies, for being here. If people are interested in making an appointment with you, how do they do that?
Yeah, so if you are a student at Patrick Henry or William Fleming, and you could just stop on by, and sometimes we have same-day appointments if you're not feeling well, or you could schedule something in advance if you're trying to get your physical. And then, of course, we have phone numbers on our website, Carilion Clinic Adolescent Medicine, and you can schedule an appointment there too. So if you're unsure where your student or child can be seen, we're happy to kind of direct them. If they're not a Roanoke City student but would love to be seen by us either way, we have other places they can be seen at Tanglewood.
Okay, I was just going to say, so it is Tanglewood that they would go when you say stop on by, the Tanglewood
yes,
location.
yes, but for the Roanoke City students, they can stop on by our clinics at their high
at the
school.
school. Yes, absolutely. All right, thank you for clarifying
Yes,
that.
yeah.
Thank you, ladies, so much. We appreciate you being here.
Thank you.
Okay, all right.